Dr. Sawiak graduated in 1966 from the University of Toronto, Faculty of Dentistry, and practiced family dentistry from 1967 to 2008. The last 30 years were focused on Mercury-Free and biological dentistry. Today, she is a keynote speaker and lecturer in biological dentistry, non-surgical, natural gum treatment, pain control, wellness, and detoxification. Her course in predictable periodontal outcomes is called an eye-opener and paradigm shifter. She has authored numerous articles and 3 books. Dr. Sawiak is the past Vice President of the International Academy of Oral Medicine and Toxicology and chaired the Periodontal Committee for this group. At IAOMT conferences, she has presented numerous lectures on biological approaches to dentistry and health. She was past president of the Women's Dental Association and has mentored many dentists and hygienists in biological approaches to dentistry and health. Recently, Dr. Sawiak was a speaker at the Holistic Oral Health Summit and has spoken at numerous health shows, including the keynote at the Holistic Wellness Show in Burlington. Dr. Sawiak prides herself in constantly adding to her vast knowledge in order to serve her clients ever more completely. In 1989, she was the first woman in the world to become the Master of the Academy of General Dentistry, and in July 2011 attained her Doctor of Integrative Medicine. Dr. Sawiak practices as an integrative wellness consultant at the Sawiak Integrative Wellness Institute in Georgetown, Ontario, and has been branded the Health Detective because she seeks out hidden causes of dis-ease in order to help people back to vibrant health. Welcome, Dr. Sawiak.
Today, you will learn about how gum disease, which is supposed to be very innocuous, does affect the entire body, and that treating it as such will bring much better results for the health of your patients. So, may I share a little bit about myself? When my mother was 42 years old, she lost all her teeth to perio disease. I went into dentistry thinking I can help people like that. Well, for the first many years of dentistry, I felt I was not helping them because every time I would scale, get some blood, get some calculus, they sometimes would get worse rather than better. And I got very, very discouraged. So I started sending everybody off to the periodontist that needed perio. And it wasn't until in the late 70s that I heard of a crazy man by the name of Trevor Lyons. He said, it's parasites that cause the gum disease. And I said, oh yeah, sure. Like, parasites are something that is in the warm climates. We don't have parasites in North America. Anyways, after his course, my eyes opened and I became, of course, very, very enthusiastic and passionate about perio, and still am. The teaching and concepts of Trevor Lyons were essentially you treat the disease first and then you go and manipulate. After his course, I was doing a lot of antibiotics for people, and I was already somehow attracting a much more holistic segment of the population, and I thought, you know, I hate giving them antibiotics. They don't want antibiotics. So I started reading, started researching, and developed a non-pharmaceutical approach to getting rid of the infection. So I better read the disclaimer. I do have a financial interest in the product of my talk because I do have a course that I give. And I do not have any relationship to companies offering grant monies for this continuing education and the medical education program. But I do give a course, and the brochures are available here if you wish. Next slide. So, what criteria do we use for diagnosis? How many of you pick up the probe right away? Yes. That has been what we were taught. This is what we did, we still do. What about bleeding, swelling, odor? If I sit across the table from somebody and I can smell their breath, I can tell you right away what I'm going to see under the microscope. There is no doubt in my mind. What about malaise? How many of you know people that every time I get my teeth cleaned, I've got the flu the next day? Very many do get it. They don't relate it to the cleaning. Pockets, recession. The amount of calculus or plaque becomes a criterion for diagnosis. And sometimes the diagnosis is based on the amount of insurance they have, unfortunately. Oh, you have insurance, so you can come in every 2 or 3 months and spread the infection more. So, in your office, what is being done first? Is it probing? Is it scaling so that you clean up the patient for the dentist to come in and see them with a nice, clean mouth? Do you offer mouthwash? If you offer mouthwash, is it Listerine? There's a fact that the skin absorbs anything you put on it, whether it's an essential oil or whether it's a cream or whether it's a liquid. In 26 seconds, it appears in the bloodstream. What about the mouth? How fast does something absorb through the mucosa? Anybody know? It's immediate. That's why they put nitroglycerin under the tongue. So when you have that immediate entry into the bloodstream, doesn't it behoove us to watch what we put in our mouth, how we manipulate everything in the mouth? So, is the problem local? Is it the calculus? Is it the swelling in the gum? Is it the bleeding? Or is it a systemic problem? What is the pathogen? Most of us and MDs will say, oh, there's an infection, here's some penicillin, or here's some tetracycline. They don't know whether there is a pathogen that responds to that antibiotic. So if it didn't work, next time they come in, oh, here's a different kind of antibiotic. How many people do you know, how many doctors do you know that swab the throat before they prescribe an antibiotic for a sore throat? Do you know if what is infecting the mouth contagious? We kiss, we share food, we sometimes share the offerings in a Chinese restaurant with our own chopsticks. We eat sushi. We don't know what is coming in unless we know how to diagnose it. So, if you don't know what is causing the issue, how do you know how to treat it? Most of us just go in there and scale. Scale, scale, maybe disinfect. If you've heard enough of Dr. David Kennedy's work, you will at least put something in the sulcus to sterilize it. But that's topical. And which treatment will this patient respond to? How many of you know what pemphigus is? Okay. How many of you know that it is an autoimmune disease that has to be treated with steroids? I have treated pemphigus with an anti-protozoan protocol successfully. So why is it called autoimmune? Because the immune system has crashed. What crashed the immune system? We don't know. And this is the kind of thing that we go round and round and round in. So if there is no diagnosis before you start, how do you know how to treat the patient, what to use, when to use what? So in the 1970s, this was normal oral flora. Now with all the DNA testing, there are all kinds of various pathogens that are identified. Yes, it might be normal, but every one of these is pathogenic. However, the biome or the natural flora of the mouth, the non-pathogenic flora of the mouth, I can't see it under my microscope at 40x. So I discount those. But this is considered normal. In dental school, when we saw an amoeba from a swab from the mouth, we were told that's normal. So it's accepted as normal, but is it healthy? When I see a healthy mouth under a microscope, none of these appear. So, in 1970, when I was starting out a little bit, plaque was considered bacterial only. It was the bacteria that caused the damage. The plaque caused the damage. The plaque was entirely the patient's fault. They didn't clean well enough, they ate too much sugar, they didn't floss, whatever. So you clean off the plaque diligently, and you're not going to have perio disease. Some of the cleanest mouths I have seen have been periodontitis grade 3. So, is gum disease really local, or is it a whole body infection? Is it invasive? How many people have seen pockets of 10 and 12 millimeters? How many of you have seen anug or trench mouth where the entire cover of the gum has been eaten away? How destructive can it be? If you've seen a case of trench mouth, you know that that's pretty terminal to the teeth. Is it hereditary? How many people think there is a hereditary factor here? Thank you. Thank you for your honesty. I have never seen a case of families that have shared gum disease that didn't share the same pathogen. You have?
I have a question. So people have genetic predispositions. So if they do the same environmental or lifestyle things that their parents did, that's still a hereditary factor.
So the habits will be hereditary, yes.
Yeah.
The disease is not. It is familial, because we tend to have the same habits that our parents did, that our culture has, that our household has. Is it contagious? It is very contagious. And I can ask you a question. If you have a strep throat, is that contagious? Yes. If you have a parasite infection, is that contagious? If you have a staph infection on your skin, can that be contagious? Then why isn't it contagious in the mouth? It is contagious. And I have seen families where I can't get them cleared of a parasite. And I'll say, will your husband come in? Oh no, he doesn't have this problem. Fine. So I'm treating the wife, I'm not getting anywhere. I said, you must be getting reinfected. Okay, I'll put my husband on it whether he wants to or not. Next slide is clear. Is it contagious? Yes. You have to watch who you kiss. What happened there? Okay, stop and think. Periodontal disease is an infection. Scaling is done around swollen, bloody teeth. Whatever is in the sulcus goes directly into the bloodstream and accesses every organ and part of your body. So then, what concerns me is that every time you put a scaler in, every time you put a probe in, you are transferring that material from the sulcus straight into the bloodstream. Periodontal disease is an infection. Scaling is done around the sulcus of the tooth, and whatever is in the sulcus goes directly into the bloodstream. So the current paradigm is scaling on the intake appointment, managing perio with oral hygiene and frequent recalls, local and topical disinfection, antibiotic patches, lasers. In some cases, predetermined oral antibiotics. And I know that clindamycin, for instance, is a popular one. It is more an antiviral than an antibacterial, and quite often the surgeries like the raising of the, I forget, tunneling, I think, is one of the surgeries that is done, fails frequently if only clindamycin is used. And of course, surgical procedures at the periodontist, they keep them rich. So scaling is quite often not a very clean thing to do for a hygienist. And many hygienists, when they came to my course, they say, what a difference. I don't have to do this anymore. Planing the roots. How many people believe that planing the roots is necessary? Good. Because if you plane the roots until they're smooth, the periodontal ligament doesn't have anything to reattach to. You need the roughness of the roots. Frequent scaling, keep the deposits under control, and once a perio patient, always a perio patient. You'll never get better because you have perio disease. And of course, stringent home care protocols with repeated instructions, with repeated admonishments. I'll show you how to get in there with this floss. And here are some toothpicks, and here are some of this, and here are some of this. And the poor patient feels like this small, because they are causing their perio disease. I don't know how many of you are old enough to remember Dr. Barkley. Dr. Barkley was a preventive dentist who introduced the use of the microscope for monitoring oral hygiene. So he would bring a patient in, show them the plaque under a microscope, and then he would teach them on a daily basis for 5 days in the bathroom with them on oral hygiene procedures, and then he would show them the progress under a microscope. This was great because it engaged the patient and they could see the progress of their efforts. And that is how I got interested in microscopy. Irrigation with antibacterial chemicals after scaling is frequently what is done here. When you do that, you're closing the door after the dog has left. And fluoride treatments in trays to protect the newly scaled surfaces. That burns the gums that have already been traumatized. And the fluoride goes straight into the bloodstream as well. And pocket reduction surgery once everything is cleaned up. So, periodontal disease is a whole body infection because anything that's in the mouth, especially in the sulcus around the teeth, is going to be in your bloodstream. It's not local. Is it invasive? Yes. When you have, when you used to have to pre-medicate cardiac patients for scaling, that was because what was in the mouth was going into the bloodstream and possibly could settle out on the heart valves, right? So that's why you have to pre-medicate the patients. I have seen rheumatoid arthritis patients go into remission when I got rid of their gum disease. I have seen diabetics go off their medication after their gum disease was cured. So it is curable. It is not genetic. You might have a genetic predisposition for a lot of things, but it's mostly environmental and familial. And yes, it is contagious. Calculus and plaque are not the reason for, they are the result of the infection. And why do I know that? It's because I have a microscope. And I can take a slide, and the preparation for the slide is, do not clean your teeth for 24 hours, please. Please mature the plaque. Do not eat anything very salty, spicy, alcoholic, or citric, so you don't disturb the plaque. I take that plaque under the microscope, and I see. When they have done the protocol that I put them on, nothing moves. There are no white blood cells. There's just debris. The first slide quite often has everything moving. It has lots of white blood cells. It might have spirochetes, staph, whatever, but often they have amoeba as well. And sometimes Trichomonas tenax. So what do staph infections do? Everywhere else in the body, this is what they do. Impetigo, cellulitis, zits. MRSA is emerging as a really big problem. I have friends whose 7-year-old got an infection of the knee, ended up being MRSA. She almost died. She was in the hospital for 6 months. Thankfully, they saved her leg and she's able to use it. But it's found in gum disease. What about strep? We all know strep throat. We all know impetigo, toxic shock for some people. Necrotizing fasciitis. It's found in gum disease all the time. What about actinomyces? They look like little pieces of chenille under the microscope. If you have a lot of those, this is what happens elsewhere in the body. And did you know that this triangle here has a direct access to your brain? Brain abscesses are something that we do not take any responsibility for, but I have a little quote here to read from legal cases, brain abscesses from alleged failure to treat perio disease. The patient's final visit to the periodontist, she presented with active purulent discharge, which was seen by the periodontist. The periodontist hygienist noted 6 and 8 millimeters pockets, so the dentist gave local anesthetic to the patient so that the hygienist could deep scale and curette. The patient was sent home after the procedure, asked to return in a month for a follow-up. No other instructions were given, no other measures were taken. 8 days later, while the patient was home watching television, she experienced a seizure, the first of her life, which led to her being transported to a regional medical center. Her state of consciousness was altered, so she was kept in the hospital for neurological assessment. An emergency craniotomy was performed, draining a significant amount of pus from what was diagnosed as a brain abscess. Culture and sensitivity testing isolated Tripomena denticola, which is a bacterial species found almost exclusively in the mouth, especially in periodontal disease. This was a legal case. This lady sued her dentist. Are we doing that to our patients? I'll give you a little story, since I have a little extra time, of one of my cases. A boy, 17 years old, 6'3", basketball player, gorgeous. His mother brought him in and she said, "I don't know what else to do." At the age of 13, he developed seizures, and now he is on 5 different medications, and the doctors want to do a lobotomy on him, and the father, in desperation, was willing to sign for it. And she said, "I heard you had this cavitat. Do you think it might be a dental cavitation?" He had had no teeth out. His wisdom teeth were still there, had no fillings, had no gum disease. We did a cavitat scan, and there was a problem right there. So I said, "Has he had any surgery or anything?" "Oh, yeah. He had a frenectomy at the age of 12 and a half. 6 months later, he started seizures. We started treating the infection. There was stuff coming out of his sinus, out of his ear. A year later, he's free of seizures, he's on no drugs, and he still has a brain. That's a weird one. You'd think a simple frenectomy. The gums do not just have normal flora. So anyways, this lady did sue her dentist and apparently won. But in 1840, Ignaz Semmelweis admonished physicians to wash their hands before they went to a woman giving birth. Yet we are going into dirty mouths and cleaning them right away. So amoeba. How many of you know what an amoeba looks like? Most of us did. Most of us did that in biology in grade 10 in Canada. And when I did microbiology in Periodontal, I was told that amoeba is normal flora. And I said, but it's a parasite. Oh, it's normal. Everybody has it. So when Trevor Lyons had taken Barclay's course and got a microscope, he started taking slides on everybody that walked into his office. He didn't know what all of them meant, but he used it as a device to help motivate his patients into better home care. And then one day, a lady walked in. Her front tooth had suddenly moved out. Her gums were itchy, swollen, and red. And of course, he took a slide, and he saw what looked like a blob moving, and like a mouse running around. And she said, yeah, what's that? That's an amoeba, and I don't know what that is. Find out. I don't want this in my mouth. So he went to his medical colleagues and said, okay, how do you treat parasites? Because I saw 2 in this lady. And they said, metronidazole. So he prescribed metronidazole for her. Within 2 weeks, all symptoms ceased, the tooth tightened, and he merely pushed it back with the Holly retainer. What does that say? 87% of North Americans have gum disease. 80% of them have amoeba. When I went to a parasitologist and said, how do you treat parasites? He said, oh, I use metronidazole and I use other arsenicals. And I said, aren't there any normal flora parasites? And he said, the definition of a parasite is that it is pathogenic. There is no such thing as a non-pathogenic parasite. Okay, so what does the amoeba do? It can stay in the oral cavity in the throat without symptom for years. There is where immunity comes in. If you have strong immunity, yes, the occasional white blood cell will come out and feed that amoeba, because amoeba feeds on your white blood cell nucleus. And it also takes the hemoglobin of your red blood cell for its energy. So it even can remain dormant outside of the body on a surface for 40 hours. It can remain 48 hours at room temperature. It will withstand freezing for 18 hours. And it will survive 20 minutes at 45 degrees Celsius. So they're pretty hard to sterilize out of your life. So what is it? It is an obligate parasite, which means it needs you to survive. It likes a pH of 7 to 7.5, which is what we want for our body, right? It's neutral. But it will survive as low as 5.5. It is anaerobic, meaning it doesn't need oxygen to survive. So it can live in deep, dark places where the light doesn't shine and the oxygen isn't there. It is in those deep, dark places which are lumen dwellers. And it's also found in all these places: lungs, tonsils, esophagus, stomach, intestines, cervix, when IUDs are used in the uterus. How many of you know what zankers are? Zankers are foul-smelling stones that form in the crypts of tonsils, and a person will cough them out. You get rid of the amoeba, you get rid of zankers. Let's go back to, it's also been found in the marrow of arthritic patients. And it is often found in gum disease, as I mentioned. 80% of gum disease sufferers have amoeba. And where? 67% of all dental patients have amoeba. In the joints of arthritis sufferers, in the pancreas of diabetics, in the gut of IBS, Crohn's, and colitis patients. I have a case, it's a dentist who belongs to this Academy. He suffered with colitis since dentistry, since dental school. We cleared his parasites and his colitis went away. On the heart valve of cardiac patients with endocarditis. A little story there. A friend of mine from church came in for a second opinion. He said, my dentist wants to do a root canal on a wisdom tooth. I looked at it, and it was periodontally involved. Didn't have a tooth to bite on. I said, why would you want this root canal? Oh, he's thinking that it would be a good idea. I said, first of all, you're a pilot. You cannot afford a heart problem. You have gum disease, get rid of the gum disease first, and extract that tooth. I didn't hear from him for a while. 2 years after this incident, he called and said, Oksana, you were right. And I said, what are you talking about? I'm in the hospital having open heart surgery. He had gone back to the dentist, had a root canal done on the tooth, the perio was never treated. He lost 2 years of work. So cardiology is something that when I was working at the hospital in the dental department, the cardiologists would send patients in and say, can you assess their mouth for infections because I'm doing some cardiac surgery? And the first thing I would do is take a slide. Secondly, I would do a panoramic x-ray. And quite often I would delay surgery because the person was so infected. Other dentists would take a look at the mouth and say, you're fine. So if you are involved with referrals from cardiac surgeons, take this to heart. Strokes, diabetes. This thing settles out on the pancreas, inflames it. It doesn't matter what your diet is like. Arthritis, I mentioned already. Cancer. There is a parasite in every cancer there is. If you read any of Hulda Clark's books, the first one she wrote was Cure for All Cancers. She says, this parasite and this toxin equals this kind of cancer. So an example, she says liver fluke plus isopropyl alcohol equals liver cancer. Guess what nurses are coming down with now? Liver cancer is rampant because they are not washing their hands, they're using sanitizers, which is isopropyl alcohol. And the liver fluke, you're in a hospital, you're going to find liver flukes quite often. So cancer is very much a parasite-related thing. Chronic fatigue, even the fact that if you have quite an infection with amoeba and it takes the hemoglobin off your red blood cell, you're going to be tired because you don't get the hemoglobin. Sinus issues. Sinus issues often clear up when you clear up the parasite. sleep issues, anal itching. If your child wakes up during the night and they are scratching their anus, it's a parasite, usually worms. Bronchitis, especially bronchitis that repeatedly comes back. Asthma. Asthma has cleared up after I've done a parasite cleanse for people. Allergies. What is an allergy? It is your immune system being diminished. And so you react. And what do? They push the immune system down further with steroids so that it doesn't react. Herpes. I don't see herpes, especially cold sores, on people with good immune systems. IBS, Crohn's. How about Alzheimer's? There is an article from the National Library of Medicine, National Institute of Health, Journal of Alzheimer's Disease, that says, Alzheimer's disease, assessing the role of spirochetes, biofilms, and the immune system, and amyloid with regard to potential treatment and prevention. And what do they find in the amyloid plaque? But spirochetes. Spirochetes that are found in almost every slide of a periodontal patient. So where spirochetes are found in the brains of Alzheimer's disease, it may be considered an infectious disease. This is the first and most important consideration. It is also a chronic disease, biofilm-associated disease, and an autoimmune disease. Further, it is a debilitating disease, socially destructive disease, an exceedingly expensive disease, and lastly, a deadly disease. Do we want spirochetes in our mouths? They also are pretty nasty things. So, we are now in the post-antibiotic era. Would you not agree? Antibiotics don't work a lot of the time. MRSA type of infections is just one of the symptoms. Viruses mutate, especially when you throw penicillin at a virus infection. Penicillin does nothing for viruses. Parasites invade where toxins dare to tread. You have a parasite and you'll have a toxin, it equals illness. Our livers cannot take any more drugs. Our livers are so toxic that every person that comes into my clinic, and I do an intake on them, the live blood cell shows liver overload. They often come in with a diagnosis of a fatty liver, or they have pain over the area, or they have a list of allergies, all liver-related stuff. And we also know that there is no such thing as a pharmaceutical without side effects. So IAOMT protocols are based on science. Use them. Learn what precautions to take to avoid spreading your patient's infection. Use these precautions to protect yourselves too, because just like amalgam will go into the entire room, so do these parasites. You're not immune to them. And when you have questions, I'm open to calls, to emails, and I'll mentor anybody because I'm so passionate about it. Any questions? Yes. Yes. Easy. The Hulda-Clark protocol involves a tincture made of black walnut, cloves, and wormwood. Wormwood, black walnut, and cloves. You can get those separately. However, the cloves need to be ground that day. They can't be ground ahead of time. So if you have those three products separately, they're hard to take because wormwood is extremely, extremely bitter. I have an herbalist that makes them up for me. You can also get them from the Hulda Clark wormwood, cloves, yeah, black walnut. Yeah. There are other things that also are antiparasitics. They're called Mimosa pudica. The papaya seeds. And there are many antiparasitic protocols out there. I have just used those because they are simple and straightforward. With this, I use a kidney tea. I forget all the ingredients in them. I can send them to you if you wish. And that is to open up the kidneys so that the parasites have an exit. They are on this for 30 days. After that, I encourage every client I have, because they came to me with health problems at this point, to do liver cleanses. These are liver flushes. And I have found cancers go into remission just with liver flushes. So that is the whole body protocol. The oral protocol, you in the States have the advantage of tooth and gums products. Canada has nixed them. So if anybody's coming to visit me, please bring me some. But tooth and gums products are really good. The undergum irrigant, the mouthwash, and the toothpaste. In addition to that, I suggest Torrance powder, which is baking soda and salt with a bit of hydrogen peroxide that is tapped onto the gums. Go ahead, sorry.
You mentioned that when you use the under the gum and concentrates, make sure you have an irrigator to clean the irrigator with water and that essential oils literally eat away at the
Yeah.
we went to the product. I don't know if you have any experience with called prescriptive.
No, I don't.
It's a herbal, and it seems to work pretty well too. It doesn't do that. But
Yeah. Yeah. Because we can't get tooth and gums, I've been using the Thieves, which is a Young Living oil product, and have had good success with that. There are other products, I'm sure, like there is Desert Essence, which has tea tree oil in it. I would not encourage use of tea tree oil in the mouth because it is toxic. And if somebody is allergic to some of the things, then you need to find other ways. But for instance, if you have airline personnel in your clinics, they're going to be the ones that are going to get infected the most, because they are in recirculated air with lousy water, lousy food, lousy hours, and people coughing in their face. So no matter how many times I eliminated the infections in my airline personnel, they would come back after a few months and say, I got it again, and they can tell. So for them, what I do is I tell them, put cloves in your pocket and chew on them the entire time you're flying for the clove oil. Other questions? How do I incorporate ozone? I don't, because I no longer do dentistry. But you could do the ozone trays. I use whole body ozone to increase immunity, and I do injections into cavitations. But I don't have access to impressions and that kind of thing. But the ozone trays are complex. It's a complex treatment. and ozonated water, ozonated oil is very good. There are other things. I'm just telling you what has worked well for me. Yes?
Talking about airlines are using Dasani water.
Yeah, Dasani water is reverse osmosis water with fluoride added. Very acidic. Nestle is also fluoridated. You need to read your labels. In Canada, Naya water is sold in the Dollarama stores, and it's the best water there is. It's 25 cents a bottle. Naya in Canada. There was a question way back there. Did I answer it? Thank you.